Hi, this is Dr. Applin, and today we are going to talk about sciatica. And first, I want to define what sciatica is. First, let's talk about what the sciatic nerve is. Your sciatic nerve is actually the largest nerve in your entire body, and it's a very thick nerve and a very long nerve, and it runs, or it starts, I should say, in the lower part of the back, and it runs down through the butt muscles and down the back of the leg. And symptoms of sciatica can present in many different ways. Oftentimes there's pain, oftentimes there's weakness, numbness, or tingling. Sometimes our patients describe a burning sensation associated with sciatica-like symptoms. So when it comes to treating sciatica through physical therapy, the first thing we actually have to determine is where is that nerve being pinched and where is that nerve irritation, because it's such a large nerve, there's a lot of different areas that can cause nerve entrapment. And if we don't figure out exactly where that nerve entrapment is, we could treat you all day, every day, and you'd never really see any sort of symptomatic relief. So we do this by performing a full orthopedic, neurologic, and muscular evaluation, starting with the lower back, moving down into the hip and buttock area, and even down into the leg. And one thing that we see quite frequently with patients who come into our office for treatment of sciatica, who've already tried going the medical route, is that the medical doctor, whoever they'd seen before, is always focused on working with just the lower back. And while that may be where the impingement is, there's all these other places that could cause the impingement. And so what we see frequently is someone will go in, say, for a cortisone injection or even an epidural injection, where they will inject it into the back specifically, and the patient sees improvement for maybe a day, sometimes a week, sometimes a month, but then the pain starts to return. And the reason is, if that happens, is the actual site of impingement probably isn't in the lower back. Oftentimes the butt muscle, specifically a muscle called the piriformis muscle, is responsible for that nerve impingement. Now, the reason why the piriformis muscle is so important is because the sciatic nerve runs directly underneath that muscle. So tightness in that muscle can actually directly impinge on that nerve. And one of the most common and simple ways of tightening that muscle is by sitting all day, which in our society seems to be something that most people do on a day-to-day basis. So if you're sitting for long periods, you're literally directly compressing that piriformis muscle, which in turn directly compresses the sciatic nerve. So there's a lot of treatment options for sciatica, including massage, stretching, joint mobilization, specific rehabilitative exercises in conjunction with some other adjunctive therapies like cold laser therapy or even dry needle therapy, which seems to be specifically very, very helpful in sciatica conditions when it's related to that piriformis muscle. And for those of you who don't know what dry needling is, it's essentially using very, very thin needles, similar to what an acupuncturist would use, but specifically for trigger point therapy in those muscles. And you find those tight, sore muscles, stick a couple needles in them, and it immediately releases the pressure that's surrounding the nerve. So I hope this article is very informational. Thank you very much.